Hi, I'm Marty Salt, and you're watching WFTV.com's Care Connect. If you or a loved one suffers a critical injury, every minute matters when it comes to life-saving treatment. Here to talk about the trauma care available right here in Central Florida is Dr. Peter Pappas, Trauma Medical Director and Board-Certified Surgeon at HCA Florida Lake Monroe Hospital. And welcome, Dr. Pappas. Thanks so much for being here.
Thanks for having me.
So, Dr. Pappas, what does it mean to be a trauma center?
Trauma Center is a very special place. It's a specialized hospital which has all of the resources and expertise a patient needs when they're critically injured. Our center, HCA Florida Lake Monroe, is part of the HCA Florida network of trauma centers. Our sister center is HCA Osceola in Kissimmee. And really, HCA has, I'd say, the largest network of trauma centers in the country. We really are America's trauma center. And our system here in Florida is also state regulated by the Florida Department of Health, which really adds just another layer of both accountability and purpose for what we do, because we really are there for everyone.
Kind of a natural question. What is the difference between the emergency room and a trauma center?
A trauma center is where all of that great expertise and all those resources come together to help a patient who's critically injured. In an emergency room, you'll have an emergency room physician, and the nurses work together to assess and stabilize a patient who might be ill or critically injured. But in a trauma center, that gets amped up a lot. You have specialized areas that we call trauma bays, where trauma surgeons like myself and emergency room physicians and all of our allied health providers work together to really focus intense efforts on assessing, stabilizing a patient, and getting them the optimal care they need when they're critically injured.
What are the most common traumatic injuries that you see?
Well, believe it or not, it's falls from standing.
Standing.
Falls from standing, especially in our older population, is a serious issue. That can lead to life-threatening injuries, both in terms of head injuries and spinal cord injuries, as well as other orthopedic injuries. Followed behind that are, as you would expect, motorcycle crashes, motor vehicle crashes, and then a relatively new phenomenon, e-bike crashes.
Wow, yeah, I've seen more e-bikes out, just in the last few months, really, with summer. This would seem obvious, but why is it so important, explain to us, to have trauma centers nearby?
The golden hour, the concept of a patient when they're critically injured. We want them to get to the care they need, to optimal care, as we call it, within 60 minutes. The way our trauma centers are distributed here in our community really make that possible for everyone in the Metro Orlando area. So we're very blessed and fortunate.
Once a trauma patient is stabilized, then what happens next?
Once a trauma patient leaves the trauma bay, the rest of the team, the whole system kicks in. And that's an important thing to bear in mind. You've got to think of a trauma center as not just a group of providers, a group of physicians or nurses or physician assistants or nurse practitioners within a hospital. It's everyone. It's the physical, occupational, and speech therapists. It's the pharmacists. It's even the environmental staff. Being a trauma center really takes a whole hospital. So after a patient leaves that trauma bay, whether they go to the operating room or the ICU, that's where everyone kicks in and does their part. As that patient advances through care, if a point is reached where they need inpatient rehabilitation, we're fortunate within the HCA network that both of our trauma centers here in the Orlando area have built-in inpatient rehabilitation centers. This allows patients to make that transition from inpatient care to rehabilitation, but still stay within the same care environment, so there's a continuity of care there.
Great information. Thanks so much, Dr. Pappas. And if you would like to learn more about comprehensive health care in our area, please visit HCAFloridaHealthcare.com. I'm Marty Salt, and thanks for watching.